Hi class, okay, let's continue on with acid-base, and now we're going to talk about metabolic alkalosis. So again, you go first understand, you look at whether it's acidosis or alkalosis, you'll look at the pH first. But again, let's tack it with a disease process for you to think about. So something like prolonged vomiting, diuretic use, antacid use, or gastric suction, okay? Things that you're actually losing acid for because now we're not acidotic, you're alkalosis. You're alkalotic, which means your pH is up or down, okay? Usually up, probably greater than 7.45. Again, because it's not a respiratory issue, we don't have a CO2 problem per se. It's going to be a bicarb problem. So because again you're alkalotic, your bicarb technically should be aligned with your pH, and so as a metabolic problem, it would be on the higher side. Because now you have lost acid. And again, you have to bear with me because, I'm thinking about the up and down and the opposites as I'm talking to you. And so if we say that you're alkalotic and the bicarb is aligned with the pH, technically it should be high because you retained enough base and you've lost acid, which makes sense. Now, just to kind of backtrack here with the pH, if you got a higher, if it's higher than 7.45 and you're alkalotic, that means that you have dropped the number of hydrogen ions. Okay, so that's going to be low. Again, now, you have to think about, okay, something like you've suctioned out all this gastric juice, you've lost a lot of acid. How do you correct the problem? Let's make it simple. Something's going to need to compensate to either give you more acid or excrete base. And so because we have a metabolic issue, your lungs are going to be the one that's going to have to compensate. And so how do they compensate, or how do the lungs compensate, is they'll actually decrease the respiratory rate in order to retain CO2 so that you can bring the CO2 back up and so you could bring the CO2 back up, increase your hydrogen ions, and then drop your pH. There we go. So because you're high, and what you do is you want to drop the pH. And so because of the metabolic issue, lungs will compensate, decreasing the respiratory rate by decreasing, you breathe a lot slower, so you retain CO2 rather than blowing it off. You'll increase your hydrogen ion, decrease your pH to correct the problem. And that concludes metabolic alkalosis.